Hi, I'm Dr. Eric Chang. I'm a urogynecologist and pelvic reconstructive surgeon. Today, I'm here to answer all your questions you may feel too shy to ask your doctor about pelvic floor disorders. Today, let's talk about overactive bladder. Overactive bladder is not a disease, but rather a name for a group of urinary symptoms characterized as sudden, urgent, and frequent need to urinate. These symptoms can occur when the signals between your brain and bladder fire, even when your bladder isn't full. This then leads to involuntary bladder contractions. Symptoms can include finding yourself with sudden urges that are difficult to control, urinating frequently, usually 8 or more times in 24 hours, and waking up more than 2 times during the night to urinate. 40% of women in the United States live with these symptoms. Several conditions may contribute to signs and symptoms of overactive bladder, and they include neurological disorders such as stroke or multiple sclerosis, diabetes, urinary tract infections, hormonal changes during menopause in women, abnormalities in the bladder such as tumors, bladder stones, or foreign bodies from prior surgeries, and even having a diet full of bladder irritants. So overactive bladder is actually a clinical diagnosis based on your symptoms. However, in the complete evaluation of your condition, I may recommend a cystoscopy to look inside your bladder or urodynamic testing to evaluate the function of your bladder. Treatment options for overactive bladder include conservative therapy, medical management, and surgery. I may recommend a trial of pelvic floor physical therapy to improve your bladder control, or try various medications to decrease the squeezing of your bladder to minimize the sensation of urinary urgency or frequency. There are advanced treatment options that I can offer, and these can include bladder nerve stimulation and Botox injections to the bladder as well. I work with you to come up with a treatment plan that will best fit your needs and your goals. If you'd like to discuss your treatment options for overactive bladder, I encourage you to talk to your Advantia OBGYN or your primary care provider for a referral to me.